Hi, good morning, everyone. Just give us like 2 or 3 more minutes. We want to see if we can get a few more people, giving them enough time to join. So we're going to give about 2 more minutes for others to join. Thank you. Hello, everyone. Good morning. Thank you for joining the Georgia Clinical Quality Measure System webinar. My name is Christy Washington, and I'm the Pop Health Data Analyst here at DCH, and I'll be your moderator for today's webinar. Jeff Jacobs with DXC Technology will present an overview of the project, followed by a system presentation by Teresa Harris, also from DXC. A clinical perspective will be given by Dr. George Matthew, and Brady Noel with Health Tech Solutions will share a sneak peek of future enhancements to the system. This presentation will show the system capabilities and functionalities, including how to enter clinical measures data and generating provider performance comparison reports. I would like to remind everyone of a few housekeeping rules. Please hold all questions until the question and answer section. At that time, please raise your hand and we will unmute your line so you can ask your question. You may also type your question in the question pane and we will read your questions out loud. This webinar is also being recorded. The presentation as well as the recording will be available on the DCH website. And this presentation is available for downloading, and you can find this located in the handout section. If you're unable to download this presentation, please send an email to hit.info@dch.ga.gov. Again, that's hit.info@dch.ga.gov. And we'll be happy to send you a copy. And there will be a brief survey at the end of this webinar, so please take a moment to complete that as well. At this time, I will turn it over to Jeff.
All right, Christy, thank you. Good morning, everyone, and welcome to the webinar. We want to share with you in this session a little bit about the project that is run by the executive sponsor group with the Health Information Technology Division. That is a division within the Department of Community Health. We're sharing with you here our mission, as you would expect. A goal to provide access, affordable, quality health care to Georgians. And then, of course, we've got our purpose, shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. The agenda, again, it really boils down to we want to share with you information about this project, the Clinical Quality Measures Project. We want to show you a little bit about how the system works. We want to give you a little bit of a clinical perspective with a member of our advisory board, Dr. George Matthew, and then show you a little bit of what we've got, what we're working on for future enhancements, and then take any questions. So we know you have a lot on your plate. We know you're busy, so we really appreciate you taking time to be with us this morning. We'll try to be very efficient with your time and share a lot of good information with you. Okay, right off the bat, we want to do something a little interactive. And so we've got a polling question for you. So the application has a way for you to answer yes or no. And the question is your practice currently looking for an effective way to capture clinical quality measurements? Is your practice currently looking for an effective way to capture clinical quality measures? So if you could give us a little yes, no there, we'd appreciate it. It always helps to get a perspective from the folks attending on their current level of activities as it relates to the topic. All right, so it looks like we've got a couple folks with yes and one no. Thank you for taking time and sharing that feedback with us. So let's tell you a little bit about the project. So you'll hear us refer to CQMs, that's clinical quality measures. You're certainly familiar with that reference. The goal of this project is to implement and operationalize an effective way to accept clinical quality measures, or CQMs, from providers across multiple channels. Really, multiple channels boils down to we've got a website where we can collect that data, and we also have the ability to receive electronic data interchange, or EDI files, for folks to send the data to us. So we're going to share with you in a minute what exactly those CQMs are. But the goal is to assess trends against various benchmarks. Right now we have some statewide measure data that we compare some of our CQMs against. And this is a big theme right now coming down from CMS. Attended the Medicaid Directors Conference a couple of months ago, and you're really hearing this theme of we're making big investments. What are we seeing in terms of some of the outcomes? And clinical quality measures have been around for a long time, and they give a great way to give some of that visibility. What you have historically seen is a lot of data collected from claims. This project is hoping to collect data directly from electronic health records and some of the clinical quality measures that frankly are standard and typical data maintained within the EHR system that's available for us to import into our application and share back in hopefully helpful ways. Our goal is a phased approach. We're not looking to have every provider in the state participate. We are looking to build a platform that we can leverage for more providers to participate. So we have lessons learned, we gather information, we find out what was difficult, what was a barrier, what was a challenge, and then we implement some changes to improve on it, and then hopefully continue to evolve and make it a really efficient process. Again, a recognition that you're busy, you've got a lot on your plate, there's a lot of different missions that you serve within your facility, within your clinic, within your where you provide services. And so at the end of the day, We want the sharing of this data, the collecting of this data, to be super efficient. So obviously, when it comes down to the project benefits, these are right in line with some of the mission and purpose that you saw earlier in the call. Ultimately, it's about improving health outcomes for the members and aligning with some of the CMS efforts around standards and quality efforts. Again, creating a platform that the department can use to perform consistent, rules-driven, not anecdotal, not feedback, but rules-driven data, standard measures. And then, of course, you've got the 3 goals down there at the bottom. Okay, so let's tell you a little bit about specifically what's involved in the project. So we've got an application. It collects EHR information, output from EHRs in a standard CQM manner. We'll train folks on how to use the application. We have a really simple registration process. That was a little bit of a barrier. We've even made that more efficient, where we can leverage information from the system that we operate for claims processing. We can accept data manually entered. We can accept data through QRDA Cat3 files. That's really just the EDI file. We're often used to talking about 837 files for claims for X12 transactions. This is essentially the equivalent on the EHR CQM side of the house. And so we can collect that data manually. We can even enter the data for you, right? And so again, we're trying to be very flexible in the way that we have folks participate. Ultimately, the application displays provider measurement data. There's a dashboard. We're going to show you a little bit of that functionality in just a minute. And then I mentioned that we've added the assistance of a data entry clerk. And frankly, we're not all that standard in the way that the data needs to be submitted to us, right? So if you've got a report that comes out of your system that has the CQM measures, we can leverage that and enter data using that approach. We do have a clinical advisory board that supports us. We have a number of physicians that participate, a number of clinicians, multiple disciplines that help give us input on the measures that are selected. We also take that input from project participants, recommended uses of the data, the ways that we can collaborate using the information and make decisions using the data. Right now, we've got 39 active individual providers from various group practices. Again, the goal here is not to have every provider participating. We want it to be small enough so we can engage individually, support the capture of the data in an efficient process, and then show you how to see that information and take advantage of it for your team's benefit. The information that we collect is not at the PHI level. So we're collecting information at the aggregate level. So that avoids any concerns about individual member data. We've got groups with different practices. We've got 13 different CQMs in the system, and we hope to load that data quarterly. We know that some programs today operate on an annual basis, but our hope is to collect that data on a quarterly basis. So let's look at some of the measures that we collect. This has evolved. This has changed based on input from participants. We wanted to get a little behavioral health view. We wanted to get some pediatric practice information. We've got some older population CQMs in here, and then some generic kind of measures that are very common regardless of practice type. The next page shows some of the recent additions that we've made. And again, you see it ranges the different types of screening, from a depression screening, congestive heart failure screening, breast cancer screening, ADHD medication usage, high blood pressure, weight assessment, testing for children with pharyngitis. I pulled that off pretty good for a guy from UGA. Okay, so let's go to the next slide. Here we have hit the better part of our presentation because we want to show you a little bit about the system. And so we're excited about the application. DXC is involved with it. We partner obviously with the department, but also with a great group out of Kentucky, Health Tech Solutions. And we'll hear from them in a minute. But let me turn it over to Teresa Harris, who is one of our project representatives, and will share a little bit about the application. Teresa?
Thank you, Jeff. Good morning, and once again, I'm Teresa Harris, and I'm excited to give you a little more information about the Georgia Clinical Quality Measure System, as we call it, the GACQMS. So what you're currently seeing now is your login screen. So once you decide to participate in the program, we provide a login ID, which will normally be your NPI, and then we'll also provide your password, which you may also change once you have logged into the system. You'll be prompted to change the password. Also, if you see, we have a normal buttons there where you submit. You can reset, and then you can also do register. And then also you have the forgot password, which sometimes I know we have so many passwords, we forget what our password is. So we do allow you to click the forgot password, and it will send you an email of your new password. All right. So now, once you're logged into the GACQMS, you'll be presented with the dashboard. So we are real excited about our dashboard being displayed once a provider logs in. What you will see on your dashboard will be the current year, the current quarter, and you'll see a bar graph that will display, it's called My Measures, which is represented in the black, and then the state average measures, which are represented in the blue. So what you'll see there is your comparison of your CQM data that has been entered for that specific year and that quarter. On your dashboard screen, you have the option to be able to reflect back on, let's say, year 2019 and quarter one. So you would just simply select the quarter drop down and select quarter one and hit the filter button, and then that will refresh your screen and allow you to go back and reflect on your data that was entered for 2019 quarter one. Also on the screen, on your dashboard screen, you'll see several buttons listed above in the right corner, which is the printable version, the View All CQM Statistic button, and the Export to Excel. So you have plenty of options here to be able to print your data for the year and the quarter that you're viewing at that time. Your View All CQM Statistic report will give you a report of all your statistic data from the beginning to current. Export to Excel is great for those Excel experts who love putting numbers in Excel and generating different types of reports. Also on your dashboard screen, you have the CQMs that are listed, and they're listed in numerical order. So on the right side, you have the CMS ID, which would be 26950. So your CMS IDs will be listed there. And then also, if you look on your graph, on the bar graph, the CMS IDs are listed below on the lower part of the graph. Okay. Also on your dashboard, you can see at the lower right corner, we have 1, 2, and 3. Well, since there are so many CQMs that we're currently documenting, it's currently reporting in the system, we don't want to crowd the screen, so we allow you to be able to advance to another screen to be able to continue to see the CQM data. Right? So let's say we want to continue on and look for CQM 136. So we would press the number 2 button, and it would advance to the screen that you see currently. Again, if you look in the lower right corner, you'll see that we're now on screen 2, which is highlighted, and then we'll have screen 3, which will continue on to the next set of CQM data. So the trick to one of these, the great So one of the nice features that I like about the application, and you list the CQMs, once you click on the CQM, you get more reporting information. So if you click on CQM 153, okay, once you click that, you'll be displayed a trend graph. And the trend graph will also allow you to look at an overview of different quarters for a specific year. Also, with the application, there are certain CQMs that have stratum information that is being reported as well. So once you click on let's say 153, which is a stratum CQM, you'll be displayed a stratum statistic report also. Again, these reports also have the printable view version, export to Excel, and the view all statistics report. So next, now that you have looked at your dashboard and you say, okay, now I'm ready to enter my CQM data, we have several ways to be able to enter your CQM data, 2 ways rather. You can enter through a manual entry process, or you may also enter through a QRD summary process, which will be a file that your EHR or your EMR vendor will provide for you. So what we're going to do first, we're going to walk through, let's say, a manual entry. So what that means is you'll be able to go through the system and enter your CQM numbers manually. Once you click the manual entry button, you will be displayed the CQM data, the CQM screen, and the CQM screen goes in numerical order. So first one would be CMS2, and then you'll be advanced to the next screen. Let's look at this one, CMS2, which is the preventive care and screening for depression. So what you see here is the preventive care screening requires reporting for numerator, denominator, exclusion, and exception. So you would just simply enter in your numbers that's provided from your EHR vendor. Once you enter those numbers, you will hit the next button, or you may hit the save button. A couple of notes on this screen is you can see the red asterisk. The red asterisk indicates that these are required fields. So you would have to enter the numbers that are required for the numerator, denominator, exclusion, exception, or if you have no data to report here, zeros are acceptable. So during this demonstration, we're advancing a little further into the CQM data. As I mentioned before, it's in numerical order, so it would go from each CQM data to the next one. So here we're displaying CMS ID 128. CMS 128, if you can see, has 2 populations. So from here, you'll be required to enter the numerator, denominator, and exclusion for the 2 different populations. Also on the screen, you'll notice on the bottom right corner, we have those great buttons. We have a previous button, a next button, a save button, and a cancel button. The previous button will allow you to go back to the previous screen. So if you realize that, oh man, I just really didn't forget to put in the correct information, you hit the previous button, and it will allow you to go back to the previous screen. Also on this screen, you can see where the CMS IDs are look as a hyperlink, so they're in blue color there. So once you click on those, you'll be able to you'll be given additional information for that CQM. Okay. So clicking on the CQM ID, like I said, will give you more information. So if you want to see what's all included for your numerator denominator, you click that CQM ID and you may proceed to go through the additional information required for that CQM. Okay. And if you, once you get to this screen, just click the back button that's in the upper right corner, and it'll take you back to your previous screen that you were currently working on. The next screen is the CQMID for chlamydia screening for women. For chlamydia screening for women is a screen that does stratum reporting. So this is a great screen that we talked about with stratum reporting. You also have to enter that information. And for stratum reporting, your numbers and your total population would definitely have to add up. The system has been developed to definitely help us or help you as you enter your data, where if you enter an incorrect number, an error message will appear, just kind of give you information how to help you correct it or put you back on the right path and get you back to entering your data correctly. Okay. So the next screen is once you corrected your data, you may advance forward by hitting the save or the next button. The next button will automatically save the data for you. So you can, however you feel comfortable with, either next or save, it's a great option. Okay. Once you click the save, the next or the save button, and you're at the end of entering all of your CQM data, a verification screen will pop up. You will be displayed the verification screen, and what this is saying is just simply just tell me, you know, your initials and your MPI that you entered the data for. And after that, you can click the submit button, and voila, your CQM data has been entered into the system. Go ahead. All right. So now that your data has been entered into the system, you'll be displayed this neat summary page that at a glance you may go back and look at all the CQM data that you entered. The data is expandable, so you can expand the data or you can collapse to just see which ones that you would like to look at in more detail. All right, so that's entering CQM data in a manual entry. Now, if we enter CQM data as a QRDA3 file, so that's an electronic file. That electronic file will be provided by your electronic health record or electronic medical record vendor, and they will provide you that CQM file for quarterly data. And so what you do is you come in, you click QRDA3, you select the quarter that you would like to do your reporting for, and you select the upload the file. And sometimes we put our files on our desktop, or sometimes we store them in a shared directory. And so wherever you place that file from your EHR vendor, you just simply select that file and then continue. It's a quick step for entering your CQM data via a QRDA3 file. And also, once you enter your QRDA3 file, you have the summary button as well, so you'll be able to see your CQM data as a glance also. Thank you for listening to the CQM data demo, and we look forward to working with you and getting that next training session into your data.
Thanks, Teresa. And one thing I want to emphasize is, and we're gonna hear from Dr. Matthew here in just a second on a clinical perspective, and we do want to get your input on the polling question in just a second. But one thing I want to emphasize, we're showing you a lot of screens and a lot of the functionality of the system, but one of the great aspects and one of the aspects that we've really focused on is how to collect that data where you want to provide it. Do you want to provide it through an EDI file that's generated out of your EHR system? Do you want to enter it in a way that's manual? Do you want us to enter it, right? So it can go either way. The data that's provided, if you've seen these reports, it's very straightforward data. At the aggregate level, it's essentially, as Teresa showed, collecting a numerator value, a denominator value, and when applicable, an exception or exclusion value. And so we know that not everybody's going to collect data on every CQM. So it may be you've got 3 or 4 CQMs worth of data to enter, and we're talking less than 5 minutes of data entry on a quarterly basis. And so, and then ultimately that leads to your access to the information on the dashboard. So I did want to just stress that we're showing you a lot of details, and this system has a lot of functionality and layers to it. But at the end of the day, it's really set up to make it a really efficient process for the data collection. And so we're really, again, very sensitive to the recognition that you've got a lot on your plate, right? And we're looking for folks to participate in the project. Well, let's ask you the question: after viewing the system presentation, after having a chance to see it, how likely are you to recommend the system to your office staff or other colleagues? Would you view this as helpful to get a perspective on how are our providers performing? How am I performing? Maybe against some statewide measures. I will suggest, though, that the goal of this project initially, it's really about what's involved to engage providers to participate. The data is not, it's really about how is it useful to you. It's not about how is it useful to the state. That's down the road. We hope that that'll become a feature and a capability, but right now it's really about how is it useful to you. Okay, so Dr. Matthew, do we have you on the line? Thanks for your input for folks that voted. Dr. Matthew?
Yes, can you hear me, Jeff?
We can hear you great. And so, again, Dr. Matthew is a participant on our clinical advisory board, and it currently practices out of the cold state of New York. So, Dr. Matthew, we'll turn it over to you for a moment.
Thanks, Jeff, and thanks for knocking my state while you're at it. Hey, everyone. As everyone said, my name is George Matthew. I work as the Chief Medical Officer for DXC Technology, and I work obviously as part of this program. And I am still practicing as an internist in the greater New York City area in a county called Westchester. I'm coming to you to talk about this program, the CQMS, and how not only is it kind of affecting how the state views things, but I think in some ways it's allowing us as clinicians to have our voice heard at a federal level as well. As you know, the whole purpose of this is try to improve patient care and quality. And I think from the beginning of it, I have to commend a lot of the folks that have been working on the platform. They already came in with the idea of trying to keep as much work out of our way, or out of your way, I should say, in practicing and seeing patients, but still being able to capture some of that data in the easiest way that they can possible. And it's been an iterative process, right? Trial and error. They would try something, try to get feedback from folks as we were recruiting folks to come in, and then improve the system so it'd be easier and easier for folks to use. The goal isn't to be a burden in any way. It's to try to help people report on how they are performing on these clinical quality measures, and more importantly, establish a baseline for what people should expect. For many of you, the weakness for a lot of quality measures in general is the fact that it doesn't take into account some of the social issues you have to deal with, whether it's access to care or whatnot. But I think the state of Georgia is taking a different approach, which is why CQMS has been, in my mind, successful. They're not trying to dictate to folks necessarily. They're just trying to capture as much information as possible and trying to hear your voice as to what's going on in your individual practice. I think one thing in particular that needs to be taken into account is how this is being affected at a federal level. Jeff and I and Winter and some of the other folks that you'll either meet or have met already, our company works across 40 plus states. So what we're seeing from the federal level, as many of you may know already, there is a push to try to change how Medicaid is funded. They're going to be pushing more towards block grants, where it's a fixed amount for the state to try to figure out how, quite honestly, how to pay you for delivering the care you do to Medicaid folks. Then that can be challenging. I think the state is trying to find the best middle road possible, which is how do we reward the people that are doing the best they can by their patients, but at the same time use the limited budget we're getting from the federal government to do it. And I think the good thing about Georgia is that They've been trying to do this for some time now. So in many ways, they are serving as an example, I believe, compared to some of the other states that are still figuring out value-based care or bundles of care or any other type of value-based programs. The fact that it's running and we're trying to get people going and we're trying to build it in a way that tries to be collaborative with the providers seeing patients is not common, at least from the programs I've seen and that we've been involved with. So I got to commend the folks over at the state for trying to bring in as much input as possible. But towards that end, though, when I look at some of the work we've been doing on the clinical advisory board, there's myself, there's other folks that work with CTS. You've heard some of the folks on the phone as well. We are doing as best we can to represent the clinical community to talk about what day-to-day practice would look like. But obviously, the best voice is yours. If there is input you have on how to make this better, you'll find a willing audience at the state as well as with HTS and DXC to try to make this as easy to use as possible so that you can get reimbursed properly and recognized for helping folks that wouldn't get help any other way. Jeff, I think I went over my couple minutes, but I think I got most of the points out.
Thank you, Dr. Matthew, and we're all big fans of the great state of New York. And I think you've got our new project slogan, "The best voice is yours," because that is exactly what we're wanting to accomplish. We're wanting to engage folks that'll give us feedback and say, what would be great is ABC, and then we turn that into our next change order. So that's fantastic, Dr. Matthew. Thank you. I believe Brandy Noel is going to give us a little insight into upcoming changes as we continue to enhance the application, and then we'll take any questions from our participants. Brandy?
Thank you, Jeff. Good morning, everybody. I wanted to take a moment to show you one of the future enhancements for provider users that's going to be available mid-February. If you can move forward there for me, thank you. So the slide you are seeing is the Geo Mapping report screen. This feature provides an interactive state of Georgia map to allow users the ability to view the clinical quality measure data that has been reported for a given geographical area. The Geo Mapping report screen filters by year, clinical quality measure, and either state, region, public health district, as you're seeing on the screen, or by county or zip code level. Users can filter for data that will reflect the numerator, denominator, and percentage for a selected area. This data can also be exported to Excel. Our next webinar, which is scheduled for March 31st, will provide a complete demonstration of this functionality, so we hope you'll join us. Back to you, Jeff.
Thanks, Brandy. Excited about that geo mapping functionality. That's going to be great and very helpful for our providers in getting some insight into how we compare across some of the geographies. So we've got our last polling question, and then we're going to open it up for questions. Did you find geo mapping to be an important component of data analysis for your practice? Do you use that as a tool? And does it help with data analysis for your practice? So thanks again for those that are giving some feedback. This is helpful. We're very interested in your feedback. And we'll move on to our final slide here. So one of the things that we hope to do is to share information with you about this project and then find a small spot on your calendar where we might be able to schedule some time and follow up if you have some interest in participating. We have a great group that participates with us today. Again, we're very sensitive to you've got a lot going on, and so we hope to take advantage of technology that's already in your office that has the ability to generate these reports, and then how we move that data into a centralized repository where we can do things like have the dashboards, compare against state averages, and great enhancements like geo mapping. So if your organization would like to hear more, no commitments required. Let's just talk and share a little bit more with you, maybe answer any specific questions that you didn't hear addressed on the call today. You see our gacqms@dxc.com email address, or you can call us. Don't call right now because Teresa's one of the folks that helps answer that phone, so she's focused on the webinar right now. Thank you, Teresa. And then we'll have some additional webinars in the future. You see the website there for that link. So again, we so appreciate your time today, and do want to open it up for any questions. You can write a question using the question panel, or you can they come off mute? Christy, how does that work? Or you can come off mute if you would like to pose a question to the group. Let's make sure we take that off. You ready? We're going to take everybody off mute. So if you're having a great conversation about the Super Bowl because our webinar's over, then pause that for a second. Okay. Any questions from the group? Let's see if we have any handwritten questions or folks that have a question. I think folks can unmute directly if they'd like, right? And we're unmuting folks as we go. Again, if you would prefer to stay muted, you'll just have to use your phone mute features. But we're going to take the mute off for the attendees. Again, thanks for attending. Any questions for the team? I think we've got everybody off mute. Going once? Okay. Again, just to highlight, we're flexible with the project. We can enter the data for folks to make it for efficient or for folks to participate. We'll come to you. We'll schedule conference calls, your availability, and so we're anxious to expand our attendees and participants. So would appreciate your follow-up. And you can reach out to us. You'll also see us at the upcoming Medicaid Fair, which this spring is in beautiful Tifton, Georgia, not New York. Dr. Matthew tries to encourage us to hold it in New York, but that's a little bit inconvenient for our Georgia folks. Okay, going once, going twice. Thanks so much, everybody. Really appreciate your time.